Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is our second episode on the classification of bacteria under the Infectious Diseases series. So just by way of reminder, you will recognise this slide from our previous episodes, but we just need to recap that classification of bacteria is based on their microscopic appearance, staining and biochemical tests, and we look at gram stain, shape and oxygen requirements, which we covered in our previous episode. And if you'd like to know more about that or just give yourself a reminder, just click on the link that's popped up in the screen. But there are other further ways that we can classify certain bacteria, and today we're going to talk about further delineation of the gram-positive and gram-negative bacteria, as well as further classification of streptococci in particular, and then looking at bacteria which just don't fall into any of these categories. So, this table gives some great examples of gram-positive and gram-negative bacteria. But as you can see, we have further delineated them by aerobic or anaerobic, and also whether they are the spherical cocci shape or the rod shape or bacilli shape. So the classic examples of gram-positive aerobic cocci do tend to be Staphylococcus or Streptococcus, so this is something to look out for in the exam. Whereas a classic example of a gram-negative aerobic cocci is Neisseria. Anaerobic cocci are rarer, and you may not hear about these in the exams, but gram-positive anaerobic cocci, an example is Pseudomonas, and a gram-negative anaerobic cocci is Veillonella. Now going to the bacilli, so a gram-positive aerobic bacilli could be Corynebacterium, which causes diphtheria, Listeria monocytogenes, or Bacillus anthracis, which causes anthrax. In terms of gram-negative aerobic bacilli, so just moving across from the previous column, this includes Pseudomonas aeruginosa, and you'll remember the picture from the previous episode, and we will come back to that later on in this talk. E. coli, Klebsiella pneumonia, so that's one possible cause of pneumonia in, for example, intravenous drug users, and Salmonella species and Shigella species. And finally, at the very bottom row, gram-positive anaerobic bacilli include the Clostridium species, so Clostridium tetani, which causes tetanus, Clostridium botulinum, which causes botulism, and Clostridium difficile, or C. diff, which you might have heard of as occurring in patients who might have had long or recurrent courses of antibiotics. And finally, gram-negative anaerobic bacilli, there is one example here, which is Bacteroides fragilis. So it's probably worth looking at this table in your own time to familiarise yourself with the classification. And so if something does come up in the exam asking you about the classification of bacteria, or indeed perhaps a question which alludes to thinking about these different characteristics, you'll have some way of remembering them. And you'll recognise this slide from the last episode, but this is just a reminder that an example of gram-positive cocci is Staphylococcus aureus. On the next slide, we have an example of gram-negative bacilli, which is Pseudomonas aeruginosa in this case. So now we'll move on to a classification of Streptococcus species specifically, known as Lancefield grouping. So this is only used for Streptococcus species, and it's based on the C carbohydrate found in their cell wall. And this helps to identify the potential pathogenicity and the epidemiology of streptococcal infections. This table gives an overview of the various Lancefield groups, but really the key ones to remember for MRCP have been underlined here in the left-hand column, and they are Group A, Group B, and Group D Streptococcus. So we'll just cover these ones in particular. So Group A Streptococcus specifically refers to Streptococcus pyogenes, and this can cause a myriad of infections. So it can cause a strep throat, scarlet fever, rheumatic fever, which is an immune reaction to the pharyngeal infection, glomerulonephritis, which would be a post-streptococcal infection more than 1 week after the initial throat infection. Group B strep you might have heard about in the context of neonates and pediatrics. So this is Streptococcus agalacticae, and this is a cause of neonatal sepsis as well as meningitis, and can also go on to cause maternal infections. And if we just skip down to Group D Streptococcus, this includes Strep bovis and Strep equinus. And these cause bacteremia or gastrointestinal infections, particularly in the case of Strep bovis. Strep bovis can also cause infective endocarditis and is associated with the onset of colon cancer. Again, worth looking at this table slowly in your own time so that if, for example, a question on Group B strep comes up, you can associate it with the correct type of infection and therefore have a guess at how it is treated and managed as well. And then finally, there are some special bacterial groups that just don't fall into the gram staining classifications at all. And this is due to the way that they are structured. So we have obligate intracellular bacteria, which require living cells in order to produce. They are only visible with special stains or electron microscopy. And so some examples of these are chlamydia, rickettsia, coxiella, and legionella. There are some bacteria with no cell wall, and these lack peptidoglycan, and therefore they cannot be detected by gram stain. And these include mycoplasma and ureaplasma. And so mycoplasma, you will know, causes TB, and we'll talk about TB in a later episode. And finally, there are spirochetes, and these are spiral-shaped, which are too thin for gram staining. So these are diagnosed by dark field microscopy or serology. And examples of these are Treponema pallidum, which cause syphilis, and Borrelia burgdorferi, which causes Lyme disease. So now let's try a question, taking all of that together. A laboratory technician is performing a bacterial identification test on a sample from a patient with a suspected streptococcal throat infection. The bacteria isolated from the sample are gram-positive cocci that are arranged in chains. Further tests reveal that the bacteria agglutinate with antiserum specific for the Lancefield group A carbohydrate antigen. Which of the following is the most likely identity of the bacteria? So I'll just give you a second to read that again. We've got a few clues within this rather long vignette. So we've got someone with a streptococcal throat infection. They are gram-positive cocci arranged in chains. And we know that they agglutinate with antiserum specific for Lancefield group A. So these are the options. Our options are Streptococcus pneumonia, Streptococcus pyogenes, Staphylococcus aureus, Enterococcus faecalis, and Neisseria meningitidis. Now, the question talks about Lancefield grouping, so we know immediately it must be a Streptococcus species. And you may remember from a previous slide that Streptococcus pyogenes is the bacteria which causes strep throat and is also classed as Lancefield group A. And therefore, this is the correct answer. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.